We are in Recife, the largest city in northeastern Brazil. This building belongs to the Spiritist Federation of Pernambuco. These people who have come from all over are waiting to see Dr. Adolf Fritz. Dr. Fritz performs spiritual and physical medicine and surgery. Dr. Fritz died in 1917. This man is Dr. Edson Queiroz. He is a medical doctor, a practicing obstetrician and gynecologist. He is also Dr. Fritz. As Dr. Fritz, he diagnoses, treats, and performs surgery. He uses no anesthesia, no antisepsis, and no antibiotics. Dr. Fritz has invited us to visit him and to watch his work. A warning signal will alert you to the sight of blood. 2 means an all clear.
Pensamento Nosso Senhor.
Think in Christ.
Você segura daqui. Olhando para a agulha.
Look at the needle.
Olhando para a agulha.
Look at the needle.
No canto, aqui mesmo, no canto da agulha. Não tira o olho daí, hein?
Please pay attention to the needle.
Esse tratamento
This treatment
é feito convencionalmente
is done normally with normal medicine
pela oftalmologia cirúrgica,
by ophthalmological surgery,
utilizando o processo
utilizing a process
de sucção,
of suction, a suction process.
ou seja, processo da raspagem.
He wants you to use your hands.
Dedo, coloca no olho dele e passa para um lado para o outro. Ele não sente, amolece, irmão.
He says, notice
Lê.
the patient feels no pain at all. Yes, the patient is feeling obviously no pain. My finger is rubbing against the pupil of the eye.
O médico falou que eu tinha perdido 40% da visão.
His doctor told him he had lost 40% of his sight. Do you believe that you are healed? Você acredita que você foi curado agora?
Eu acredito.
I believe. Thank you. We hope so.
Vamos lá, hein? Relaxa um pouco. Não há necessidade. Não há dor.
Telling the patient to relax, that he will feel no pain.
Ok. Registrar mais de perto o som do contato da lâmina com o tecido ósseo.
He's asking our producer to put the mic closer so we can hear the sound of the metal touching the flesh and the bone. What was your problem? Qual foi o seu problema?
O problema foi desvio na coluna.
Okay.
Desvios na coluna.
Defects in his total spinal column. Does he believe he was being healed? Você acredita que foi curado agora? He says, thank God I was healed now.
Dr. Poulos, how do you explain that? I don't think anyone can explain it. There are very few similarities to Western medicine. There is some cutting in the body, but it appears to be symbolic. The surgery that he did in the eye, definitely, there was no antisepsis or anesthetic or eye drops or antibiotics. The whole area was quite dirty. People were coughing all around the patient. He placed some saliva into the eye. What was that?
gave us a demonstration that he was applying anesthesia to her eye through his spit, and he did it more as a demonstration because he could do the same thing just by looking at her.
2 needles are in the eye.
Você não está sentindo dor, hein? Você está com medo, hein? Sem necessidade. Está sentindo dor, hein?
He's asking her if she's feeling pain.
Você está sentindo dor, hein? E por que está gemendo?
Porque a primeira vez furada da agulha.
Porque você está vendo que eu estou enfiando a agulha.
She said,
Porque você está percebendo. Quando um paciente, mesmo que diga que sente algia, dor, que sentiu alguma dor, embora pouco,
he explained, he asked the lady if she was feeling pain, and she said no, and he asked her why she was trembling. She said it was the first time she's ever had an operation like this. And he explained to the patient that the reason she was trembling is because she saw the needle that he just stuck in her eye. He said that our fear is at times connected with the visual sight, and that he promises us that she felt no pain. It was a psychological effect which made her tremble. He just made an observation that the problem with conventional medicine is that they only treat the physical body, whereas spiritual medicine, as he is now practicing, treats the etheric body or the spiritual body.
oxigenado. Mas, hein? Respirando pela boca. Não se preocupe.
Just ask the patient to breathe through his mouth.
Já. Não faça isso.
Scissors is now in right up to the hilt.
Como está se sentindo?
Normal.
Just ask,
Sentindo dor? Hein?
Pouco.
just asked the patient how he was feeling. The patient said normal. He asked him if he was feeling pain, and the patient said a little bit.
Todos esses pacientes, hein? Além
Yes, he's explaining that all these patients he's seeing now he has never seen before. All of these people are now having their first contact with him, their first meeting with him. And it's important to add here that all of this treatment is being done for free.
Stick this up and
Nasal.
demonstrate. That's
O que você está
the
fazendo
length
lá?
of penetration into the nostril, which is approximately 6 inches.
Dr. Fritz, psychic surgeon. Dr. Fritz uses knives and needles. The knife does not hurt.
Pensamento.
When he cuts into the patient's body, there's little blood. The wound from the unsterile knife does not become infected. He's made an incision, and 2 needles are placed in.
tem hemorragia.
Without hemorrhaging, he's making the cut. Let me see if there's no hemorrhage.
O intermédio das agulhas.
You know, the function of the needles.
Possuidor de metal.
Which contains metal, which is important.
Material. Verdadeiro imã para o fluido.
The needle's function is a magnet for the substance which has to be removed.
É isso que os espíritos podem fazer.
What just took place, this surgical procedure we have just seen, he has dematerialized the formation of tumors